Good afternoon or good evening, everybody. This is Dr. Scott Lamp. I'm your host for Sugar Addiction, Public Enemy Number 1, and it quite is. And so the thing is that sugar seems to present major problems in our life. Majority of at least half our population is affected by it in one way, either by showing up in lab values and things like that, or being pre-diabetic or diabetic. The other thing is it makes other disease processes worse. And so it increases heart disease problems. It makes COVID problems a problem. So comorbidities are associated with that. So let's get on with our journey here. We'll start off talking about some stats. Now, one of the sugar problems is our daily intake of sugar averages about 95 grams, which might not sound like a lot, but it adds up to about 77 pounds per year. And that means there's some people that are under the 95, there's other people that are over, and I think a lot of times they see so much. This particular stat came out, but there's another stat that talks about how many pounds of flour that you have, and so I think this number is a little bit higher depending on what sources you have. The American Heart Association recommends a daily intake of about 36 grams for an adult male, 20 grams for an adult female, and 12 grams for kids, and at our current level our population is way over the limit. As a result, obesity has been a major issue, with 1 in 3 adults and 2 in 5 kids showing various degrees of it. Now, one of the big things is that sugar addictive, and one of the reasons why sugar is addictive is because of the fact that it seems to have a very strong potential to trigger dopamine, and dopamine has this controlled pleasure and reward motivated behavior. So that's why it tastes good. And a lot of times when you got these manufacturing putting food additives to make things taste sweeter, they're looking to see how I can get you more kind of interested in eating something. It's kind of like when you have like a Oreo cookie and you just can't just have one, you got to have another and another and another. Now, studies have shown that sugar can be addicted as drugs and alcohol. It is, however, more difficult to avoid sugar as there is thousands of packaged food items in grocery stores today, with about 80% of them containing added sugars. Drinking one of today's popular beverages, you've already gone over the daily requirement. The average can of soda contains 40 grams of added sugar, while bottles have around 42 grams, and one Starbucks coffee contains about 47 grams of added sugar. Now, all health problems usually have 3 things that are important to investigate on. One is, what's the chemical side of things? What's the chemical doing? What's the emotional side? What's the structural side? In chemistry, especially with sugar handling, you usually have a tendency of sugar backing up in the blood and making things thick. Well, the problem is it slows things out. It causes things like insulin resistance. The insulin resistance inadvertently can start making high blood pressures because of that. Other chemical things start breaking down, affects hormones, so on and so forth. So this is a big issue here. But also, it also affects structure. If I block arteries or capillaries, and especially the smallest ones, you think about the eyes and the kidneys, those get blocked, and all of a sudden now I have destruction of those because you can't feed those particular organ systems. So you can have kidney problems and also vision problems. And the other interesting thing is the emotional aspect, because sugar comes from 2 places. One, it comes from the consumption and eating it, and the other one is something called cortisol, that actually is made from a stress reaction, and the body will dump sugar in there for you to get away or use extra energy to go away from danger. But this can build up, because if there's really no danger, nothing, a lion attacking you, instead ends up being, maybe a bad relationship, or maybe it's something that has to do with taxes or something like that, that brings up sugar in the situation. So you want to look at all 3 of these. So here's a question to you. How should you feel after you eat? Better, same, or worse? Can you give it a second or two here? It should be about the same, because basically the sugar should not be so much, so you should be either too low or too high. You should feel the same going in and out of eating foods. Question number 2. What raises your sugar levels the highest? That means what type of food gets in your system very fast. It's called a high glycemic index. We have carbs or carbohydrates, we have proteins, we have fats, then we have proteins and carbs. So which one do you think it is? Well, the answer is proteins and carbs. The areas of the southeast, Georgia, Alabama, Louisiana, Texas, parts of Florida, going into maybe also West Virginia, maybe the Midwest, where people are eating foods that they'll take like say ribs and put a lot of marmalade on them and use these spiced ribs. That combination actually is one of the fastest ways to get sugar in your bloodstream. Same thing with like fried chicken and sweet teas. All those things play a part. So think of how the body handles sugars as kind of like a fireplace. And what I mean by that is, it's like if I have dried leaves and I put them on the fire to burn, they burn very quickly. You get the real big flame really quick, and then it just burns out really quick. It doesn't sustain you. Okay? And if I put kindling wood on the fire, it might last a little bit longer, but then eventually starts breaking down and breaks down kind of fast. So that would be almost like a simple sugar. The simple sugar would be the first one, like an example. This would be like a complex sugar. All right? And then the third thing would be is, what happens if I put a log on a fire, or a large log on the fire? It's going to be kind of like fats and proteins, because they take a while to break. You don't get a lot of things to you really quickly, but they usually have a lot longer, slower time, and you slowly get a little bit of sugar release, and not all at one time. So that leads us to the roller coaster effect. The goal is to stay between these lines. And if that happens, you have stable blood sugar. But if I'm not eating enough and I'm dropping things down, then things have to come to the emergency aid to push the sugar back up. And sometimes if we eat too much, sometimes the sugar goes up too high. The higher these peaks and valleys, the worse it is for the body. It's hard for the body to adapt. If we eat things, body releases fat and protects lean muscle, eliminates cravings and increases energy here. We got to do that with kind of good quality fat to eat and some protein aspects that is good. It depends on how you do food combinations, what we talked about before. Proteins aren't bad, but don't combine them with sugars. And if you keep them in this level, then the body's going to stay more level. If it doesn't, then you got to get to super high and you go down and drop off, and you feel like when you stand up, maybe you might feel a little bit of dizzy, or just feel like you just don't have the energy. We mentioned before about high glycemic index and how fast it turns into sugars. And again, it's how fast you break down into sugar, and the faster it is, the cause of the fire, the spikes. Here's a high glycemic index value. Insulin spikes causing resistance to food over a period of time if it gets too high like that. Excessive sugar in sweets that aren't sweet. Okay, and then high fructose corn syrup is an additive, and it's cheap, and that's why they use it. And you find it in sodas and sweet foods and microwave dinners and condiments and chips and snacks. And here again, this is where they're talking about the 146 pounds of flour per year. You know, the other one said about 77 pounds and 142. I'm not sure right, but all of those are too much weight or too much poundage coming in from sugars. But the problem is even though we're talking about these sugars being an enemy, we have to work with them. All cells need energy to burn. So we need to have a balancing act. We can't have too much sugar, but we need some sugar. It's all in moderation, and that's the key. One of the big things with having problems with sugar is also hormonal control. And if you have a stress response, you're going to release insulin and blood sugars. You're going to increase metabolic rate. You have change on the thyroid gland. It can have an effect on sexual function. You can affect your hormones here, and then it can go back and stimulate it again. So any type of hormonal balance or problems you're having, you got to take a look to see if there's any sugar handling problems, and check those numbers too on your lab work also, because they can play a major part. One of the worst things for males, and especially males to give an example, they start a lot of weight around their torso, and it has that extra, the belly fat that's there. What happens is one of the worst things to do for a male is increase sugar and also increase stress, because stress puts sugar in the system like we talked about before. Those two combinations can actually decrease testosterone and have the body start switching over to estrogen. So again, another reason why sugar creates so much problems. Here's the addiction cycle. If you like it, you crave it, and then the addiction, and it has addictive properties. the blood sugar levels start to spike. You get that dopamine. I like that. That makes me feel good. Mass insulin secreted to drop blood sugar levels. The blood sugar levels fall rapidly. High insulin levels cause immediate fat storage, because again, it doesn't want to back up the storage. So if you don't use it right away, it's going to turn into fat storage. Body craves the lost sugar high. Hunger and cravings. Low blood sugar levels cause increased appetite and cravings, thus the cycle is repeated. Over a period of time, you keep on adding more sugars into the system, and the body can eventually start into a position it can't handle it. You'll hear about something called Metabolic Syndrome. In the past, it's called Syndrome X. It usually talks about being obesity, high blood sugars, increase in fasting glucose, increase in lipids, and that lipids would be low density lipids, and a decrease in your high density lipids. And look at all the things that metabolic syndrome can affect. You look at heart disease, lipid problems, fat handling problems, hypertension, because again, insulin resistance doesn't let potassium in the system, magnesium, which actually helps release some of the tension on the arterial system, and that makes it worse. Type 2 diabetes, dementia, big problems with that, Alzheimer's and those things, and cancer. And I'll take a minute here on cancer. The one cell that has the most receptors for sugar are cancer cells. Again, the one cell that has the most receptor sites for sugar or carbohydrates is cancer cells. And if you have a high sugar diet, you predispose yourself to possibilities of cancer. You could be feeding cancer if you have something that's there. Be very careful with that. So one of the ways to kind of fight cancer is to have a lower sugar diet. Polycystic ovarian syndrome. Again, switching of hormones on a female, testosterone levels go up, but one of the biggest problems is because of sugar. Non-alcoholic fatty livers. And if you guys have a fatty liver long enough, it gets into cirrhosis. Now we're going to talk about some of the metabolic patterns, and we're going to first talk about the elevated glucose here. Anything over 100 feel like it's getting to early insulin resistance. I like to generally mind to try to stay them around 95 or so. Elevated triglycerides, the sugars eventually have to be taken out of the blood. They're hazards to be thickening things up, so the body's going to try to make them to some transport. It's called triglycerides. They'll be on the rise. If it's there long enough, you start getting resistance, metabolic syndromes, like the picture we saw before. And we'll see glucose greater than 100 but less than 127. We'll see triglycerides start to be on the rise. We talked about that above. And then the cholesterol will actually get raised up there too. When that happens, cholesterol has a couple different things. There's LDL and HDLs. We'll talk about some of their genetic phenotypes a little bit in a second. But LDLs here are going to be going from the liver to the body to be deposited. And the HDLs are going to be things from the body going to the liver to be destroyed. And you notice what happens, since there's more sugar, there's more storage of the LDLs and less things being taken away from the body. So HDL is supposed to be the good one, the LDL is supposed to be the bad one. Uric acid, as an inflammatory indicator, goes up, and then the triglycerides will eventually go to total cholesterol. When you get into diabetes, you're going to have your sugar is going to be over 126, and your hemoglobin A1C, which we'll talk in a minute, will go up to 6.5. You want to be more in the 5.56 or below, and that's the number for that. Now, there's different kinds of diabetes we've talked about. There's diabetes in regards to just frank type 2, which is kind of learned from dessert base. There's type 1s you're born with. Your body does not make insulin at all, so that's a type 1 diabetic. But there's an interesting thing called a latent autoimmune diabetes 1.5. And how you find that is that sometimes you can go from a type 2 to a type 1 or latent type. And what happens is it's almost like an autoimmune disease, because you get all these autoimmune disease factors that are showing up in the blood. Okay, and then we can have decreased hypoglycemic and not enough sugar. And this is usually a problem with the adrenal glands. The body doesn't know how to handle stress. It needs to have some support, and it's a stress burden. And there's an adrenal gland that we'll talk about a little bit later that's supposed to help support the system is not being supported, so your sugars start to drop. And there's different kinds of patterns here that we'll talk about here that are related to that. This is hemoglobin A1C, and basically it's actually a measurement for a diabetic. There's also to kind of treat, like how's the treatment going? It's a good treatment marker for things. And basically, as an older, mature cell, we want to see a lot of sugars attached to this, but they go after the red blood cell, and the higher the amount they get attached to, the more the hemoglobin A1C goes up. And of course, here's a lower A1C. So this is a measure of an average blood sugar level over 3 months. You need to have 3 months to get to 1 mature blood cells. If you were to take your hemoglobin A1C in January and check it again in February, the number would probably be very similar to the first time. You need to have those clear out and let the next ones come into play. And when they do, they'll show how well you've been handling your treatment. Normal is below 5.7. Pre-diabetic, 5.7 to 6.3. Here's diabetic, 6.4. It's very inflammatory and can vary sometimes with some other factors. Again, when you're talking look at blood chemistry and cardiovascular, it goes hand in hand. So if you're looking at blood work, you should probably get a lipid panel to see if it's having an effect on the cardiovascular point. And total cholesterol, triglycerides, HDL we talked about, VLD is very low density lipids, LDL cholesterol, and total cholesterol HDL ratio, which should also be about 3.1 and below, which would be the number on that particular one. And then special order tests, and this is a lipoprotein phenotyping. There's different classes of HDLs and LDLs, and even though the LDL might be a little bit higher, one of the things you're going to look at is the LDL can have a class A and a class B. Now, class A's are good and class B's are bad. And what it means in class B is the type of size, the size of them are smaller. And think of it as like a healthy form of an LDL should be plump like a beach ball, and an unhealthy form is a deflated beach ball. These are deflated beach balls. They break away easier. They can form more plaquing problems. So those are the ones we're called phenotyping. All the rest of these are really kind of like inflammatory kind of markers. Homocysteine is one. C-reactive proteins another. Fibrinogen activity, thrombin time. These kind of measure different things that are important to take a look at your overall profile. Now, this is hypoglycemia, and it's normal blood range 72 to 108, low blood sugar less than 72. What happens is your sugar starts to crash and you're not recovering. You can get tiredness, you can get excessive sweating, dizziness, headache, mental confusion. And there's symptoms of withdrawal. The following withdrawal symptoms of sugar addiction may manifest as early as 24 hours after quitting sugar intake. Cravings, lethargy or lack of energy, anxiety, headaches, muscle aches, insomnia, chills, nausea, gas, and bloating. But you can recover. And when we start talking about solutions to this, there's a sugar burning pathway and a fat burning pathway. But you've got to eventually transition to the fat burning pathway. So you'll have some problems in that transition, and you can make it better or worse, but these are some of the things that have possibly happened to that. So let's look at hypoglycemia and kind of working it backwards. The complaints that people have are going to be fatigue, insomnia, depression, mood disorders, infertility. Interesting. Well, you got to get sugars to be able to maintain a pregnancy. Slow metabolism, weight gain, headaches because you're not getting blood flow there, hormonal imbalances like we talked about before. But now the symptom, that's complaints. Symptoms is because I'm craving sweets, I'm irritable with missed meals, I depend on coffee to get through the day, lightheaded with missed meals, eating relieves fatigue, I feel better. Remember, you're supposed to be the same going in and out. Jittery and shaky, agitated and nervous, poor memory, forgetfulness, blurred vision. We go to where the lifestyle that causes this is because I might be missing meals, I'm avoiding snacks when I need to, maybe I need to have a little bit of extra food just to recover so I don't drop so down on that roller coaster picture. Too high of snacks, caffeine, nicotine to suppress hunger, sweets instead of a meal, long gaps between dinner and first meal, lack of protein or fiber in the diet, and overtraining without replenishing glucose. So you got to kind of work your way backwards there. Now, pre-diabetic, you got 84.1 million adults aged 18 years or older have pre-diabetes, and 33.9% of the adult U.S. population. And if you're 65 and older, and again, you're probably not as easy to rebound, 23.1 million adults aged 65 years or older have pre-diabetes. Now, pre-diabetes is going to be insulin resistance. That's going to be too much sugar. Let's do the same thing. We'll work our ways backwards on this. The complaints. Again, we still have fatigue, but we got something a little bit different here. We have joint pain. Depression and mood disorders. Infertility again. Slow metabolism, weight gain, but thinning hair. Can't get blood flow to that. Hormones get affected, and hormones have a great effect on hair loss. Of course, there's hormone imbalances. Resistant symptoms. Fatigue. Not a pick-me-up after meals. I crave sweets during the day. Eating sweets don't resolve my cravings because I'm putting more in. I'm getting insulin resistance. The body doesn't want to put any more in the cells. It's too much. Difficult losing weight. Must have sweets after meals. And the reasons? Lack of physical energy. Exercise. Overeating, too large a plate, high sugar, high starch meals, social and pleasure eating, and then fiber, which is very interesting because fiber locks up the sugar so it doesn't get absorbed as quickly into the system of the body. Now here's some stats. Diabetes, 30.3 million people have diabetes, 9.4% of the population. Diagnosed, 23.1 million. Underdiagnosed, 7.2 million people. So to kind of go over a review, diabetes mellitus is type 2. It's formerly called non-insulin dependent diabetes or adult onset diabetes. It's now children are starting to come down with it, so adult onset has been removed. It is a metabolic disorder that's characterized by too much glycemia, high blood sugar, the context of insulin resistance and a relative lack of insulin. Type 2 diabetes make about 90% of diabetes. Diabetes mellitus type 1, into which is an absolute lack of insulin due to bracteal islet cells in the pancreas. Usually at birth, the classic symptoms are excessive thirst, frequent urination, constant hunger. Approximately 10% of all diabetics are type 1. And we talked about this too, latent autoimmune diabetes of adults, LADA. Slow onset type 1 diabetes or diabetes type 1.5 is a form of diabetes mellitus type 1 that occurs in adults. Often the slower course of onset. Adults with this LADA may initially be diagnosed as having type 2 based on their age, particularly if they have risk factors for type 2 or has a strong family history or obese. This definitely shows up as autoimmune for the pancreas, and so it's definitely associated with as it being an autoimmune disease. When we're talking about sugar handling problems and especially diabetes and things like that, when you add that to other disease processes and you have heart disease, sometimes it might be the main push of the heart disease. But heart disease and diabetes, you can see that people with diabetes, percent of people with complications increase drastically when you combine the two. So here we see what happens with the result of the sugar problems. And how they go downstream. Cardiac metabolic syndrome, obesity starts. Increase of sugar, insulin cannot get in because it's insulin resistance has happened. So it does those kind of things. You have your numbers that start showing up. But here's the end results. You follow triglycerides down and it accumulates in the liver. Then you get fatty liver. And in a long period of time, it keeps on doing that. You'll eventually actually have cirrhosis. Transported serotonin across the brain-brain barrier, decreased brain serotonin is altered from that. You have here oxidation that happens. Hemoglobin A1C up. This is oxidation to end products. Nerve damage. Myelin, some of the things when you think about in regards to like numbness and tingling in the hands and feet. Renal damage. Endothelial damage on the arterial linings. Intestinal tight junction breakdowns. And you don't even think about cardiac metabolic syndrome could actually decrease circulation. You don't feed the cells, you get leaky gut. Same thing here, fibrinolysis, fibrinogen problems, coagulation, those kind of things. A big one here is mineral-corticoid imbalances. Potassium and magnesium can't get into the cells. The blood pressure gets increased because that actually helps reduce the blood pressure. Then you get things like hypertension. Then up here, you get uric acid and hyperuricemia, and that's going to be associated with too much urine that's in the blood. To continue some of the problems, again, insulin surges here. Oxidation of leaky gut, we saw that. Transformation impairment. You have increases in testosterone and estrogen. And again, in males, you'll actually create aromatase pathways, which actually increase more estrogen into the male and more testosterone in the female. Again, pH becomes a problem. And adipocyte, which is like forming fat cells, and NF-kappa B activation is a major inflammatory response. Then cortisol surges, so on and so forth. So you see a lot of these things that cause problems with the sugar. Now here's the complications of high blood sugars. Heart attack and CVD is bad. Strokes, dyslipidemia, which again is too much fats in the blood. Hypertension. We talk about insulin resistance that does that. Kidney disease, eye damage, blindness, ulcerations, amputations, nerve damage. As you can see, as things happen, as things start to deteriorate from one point to the next point to the next point, and what happens is the nerves start to shrivel when the blood vessels disappear. So that creates some really nasty pictures there. The other thing is some additional signs. When you have sugar handling, this doesn't necessarily mean full-blown diabetes, but if you see the darkness in the armpits, neck, and groin, like you might have like a crease in the skin and it gets dark around there, that could be an aspect of having some problems with sugar handling. Absence of menstruation, again, hormone situation can create a problem with lethargy, brain fog, you can't think as well, hunger, frequent urination, extreme thirst, abdominal obesity, tingling in the extremities, like we saw before in that picture. That might be the start of something that might be happening to worry about. And skin tags. Skin tags can sometimes be associated with that type of problem. Let's look at the pathway. You eat your foods that are here, and intestines absorb the glucose after a meal. Now, if you have like things like fiber here that sometimes can help block that, so it doesn't even get absorbed in, or slows the absorption and it makes it easier on the body. Increasing glucose levels. The pancreas is the organ that actually puts out the glucose. Puts out the insulin. The insulin now tries to put and store, work on trying to grip a hold of these and try to get this into store into places like the liver. And as it says here, also skeletal muscle. A balance of homeostasis is, and normal sugar levels are the end result. Again, the kind of in a written out form, glucose obtained through digestion is transported to the cell by insulin. Again, with the controlling mechanism here is the adrenals. The adrenals, if the sugars are too low, it senses it, tries to balance a certain amount of energy that's be there. Received in the cells by trace minerals. Again, if some of these minerals are missing, chromium picolinate is one, alpha-lipoic acid. There's certain things that are doorkeepers to let the sugar or the insulin to let it into the cell itself. Utilized in cells mitochondria. Again, if you're not getting things in there, the energy is not there. Mitochondria is your kind of like your batteries for your cells. Stored in glycogen, liver, and muscles. Retrieved by a hormone called glucagon. Glucagon really gets into play. It's the opposite of insulin. Comes into play, especially when you're exercising. And when not needed, it's turned into fat, which is usually a big problem. So the problem with this is when you talk about things like insulin resistance, you got too much insulin coming into the system. So what happens is it's kind of like there's too much sugar and the place gets overwhelmed. So imagine if you're a vendor and you had all these people running at to try to get a hold of what you had for sale versus having it controlled in single file. This is more of an organized fashion, but if you have too much sugar, you get this kind of situation and not the balanced form that gets here. So the body gets overwhelmed. So what it does is it says, I can't continue, so I'm going to close my doors to you. On top of that, you get the pancreas that gets exhausted. High levels of sugar causes increased production of insulin. Pancreas gets fatigued, becomes inflamed. Deficiencies of pancreatic enzymes, and then symptoms: bloating, diarrhea, nausea, abdominal pain, back pain, possible fever. And what happens is that, let alone if we don't eat our foods the right way, we don't chew our foods, we overcook our foods, we lose our enzymes, plus the pancreas is getting hit by the sugar handling problem. It's a double whammy. This organ gets very easily exhausted. Now, fructose is a type of sugar which is actually probably one of the worst sugars to deal with. It's found in some fruits, very high in bananas, has a lower glycemic index than glucose in natural form, but the high fructose form causes faster food sugar spikes. That's after it's been processed. Found in a lot of foods that aren't sweet. 7 to 8 times more potent at damaging blood vessels than glucose, and loves to hit the liver. Again, with the fructose part here, only processed in the liver, fatty liver disease. Liver is involved in sugar regulation, storage, and releases based on need. Fructose consumption is linked directly to obesity. Doesn't cause being full, triggers liver to make body want to store fat, causes rise of triglycerides leading to weight gain. The crossover: insulin resistance, metabolic syndrome. You have high blood pressure, cholesterol, high sugar, possible potassium deficiencies. Insulin resistance and insulin resistance is stiff arteries, sodium retention, low potassium, vasoconstriction, high blood pressure, and everything to lift. And we've seen most of this. We talked about how things affect. Here's the thyroid comes in, but here it is: hormonal imbalance, estrogen dominance, so on and so forth. We've talked about testosterone in men and women. Again, another slide: high glucose, normal glucose. So we're going to take a look at what happens when you have insulin resistance, cardiovascular disease, type 2 diabetes, the retinopathy, so on and so forth. Again, same thought process, just a different look. I've mentioned potassium quite a few times, and we need roughly about 47 milligrams per day, 7 to 10 cups of vegetables a day. You know, if a good salad, you can have 4 to 5 of those cups in there. 4 times more potassium than sodium in the body, but they're in cell. It's a physiological relaxer of the nervous system, softens the arteries, prevents constipation, leg cramps, and nervous conductivity. AFib, a diuretic, gets rid of fluid and potassium. Diuretics get rid of fluids and potassium. You've got to watch out for that problem. Salt sensitive, usually needs potassium if you're salt sensitive. 98% inside the cells. Normalizes heart rate. Deficiency causes tachycardia. Deficiency with labored breathing and high pulse rate. Takes insulin to control and absorb potassium. Obviously, it's tuned in with obesity, but one of the big things is leptin. And leptin actually controls hunger. So if you have insulin resistance, you have leptin resistance. So leptin produced by adipose tissue makes you feel full. More fat tissue, more leptin. Individuals with leptin, obese, and have with leptin mutations are a little bit different. They are obese with low blood pressure. Develop resistance to it over time, similar to diabetes and insulin. So this is an exception here. And then you have food additives: all sodium nitrate, BHA, BHT, prolyl-ogalate, monosodium glutamate, trans fat aspartame, so on and so forth. Different colors: white sugar, potassium bromate, sodium chloride. Sodium chloride. The potential risk of these food additives that are sometimes used sometimes can also increase insulin resistance, but also increase cancer risk, increase hunger, stimulate insulin release, mimic hormones, restricts absorption, strains digestive organs, affect mood and behavior, and irritate healthy bacteria. I have to mention something about vitamin D. Vitamin D deficiencies inhibits the secretion of insulin from the pancreas. If the insulin is hampered in any way, it results in raised blood sugar levels and can turn into full-blown diabetes. There's also a connection of vitamin D deficiencies with many metabolic problems, like the heart disease, obesities, and the raised lipid values in the blood and high blood pressure. All these are associated with diabetes and health complications. Sufficient amounts of vitamin D are necessary to protect us from diabetes and other complications. And this is one of the reasons some of the problems that are happening with COVID and also the need for vitamin D. Vitamin D helps you with your immune system, but also on top of that, it helps with the sugar handling problem, which seems to be 80% of the people had morbidity issues of like being overweight, having heart disease, having diabetes. And this is where vitamin D is special. And we don't keep on forgetting that vitamin D should be the thing we should be taking up. We're all caught up with vaccinations. Take care of what your body really needs, and that needs that vitamin D. The role of vitamin D in diabetes was found in a study where 92 adults at risk of having type 2 diabetes were given short-term vitamin D supplementation. It improved the overall functioning of the beta cells of the pancreas and helped control blood sugar values. And also, the receptors on the beta cells of the pancreas turn on only if vitamin D binds to them. Vitamin D is also known to regulate calcium in our body, in turn helps to control the release of insulin. Vitamin D also affects our immune system. In type 2 diabetes, there is destruction of the pancreatic cells due to the inflammation reaction of the immune system. Vitamin D is able to stop this inflammation reaction and the eventual destruction of beta cells. Beta cells are the ones that make the insulin. The result is healthy beta cells producing sufficient amounts of insulin to control blood sugars. Now, besides eating that causes, or consuming or drinking that causes sugar levels, the stress mechanism is involved. In the stress mechanism, when you stress out, the body releases something called cortisol. And it's emotional stress usually causes these. As the cortisol goes up, you're putting blood out. And remember what the body's trying to do. If you see a lion coming at you, you need to have energy right away. And so what happens is you would think it would be great to go to fat stores and turn the fats back into sugars. It's not as easy as that. It takes a while. And if you're in immediate emergency help, you need something to make the sugar for you right away. So cortisol does that. So, and then the side effect is it increases your sugar to your bloodstream for your liver, impairment of the insulin secretion, and blocks insulin effect on the cells. You can see patients with perfect diet and exercise that still have diabetic patterns because they're constantly under stress. It is important to note that we can also trigger the stress response by thinking about stressful events, dwelling on past stressful events, loss of a job, fight with someone, pants your mom made you wear growing up, or anticipating something coming up like a job interview, a test result, giving someone bad news, are powerful triggers of the stress response. Now, cortisol can play a part with the adrenal stress and carb consumption also, because what happens is as sugar rises in the blood and it spikes back down again, this low level is not a good operating level below the normal line. So you get a stress response here, releasing cortisol to make that bring up. So you can also release stress or sugars that way. So a chronic stress result, either as the chronic stress goes up, cortisol levels go up, leptin sensitivity, which makes you full, goes down, hunger goes up, fat storage increases, your weight goes up. Now, there's ways to test how these stress mechanisms are going. This is called an adrenal stress index test, and it measures cortisol over time. Now, if you look at the chart, the cortisol follows the green area and should fall within normal responses is there. As you see, this particular individual had high spikes at noontime, at 4 o'clock in the afternoon, and at midnight. This tells me that they probably have problems falling asleep, they're getting hyper up here, and they have enough ability to wake up in the morning, but they're just high activity at this particular time. Now, these give us an idea of the circadian rhythm that happens, because this is supposed to be the natural rhythm of the body. High cortisol in the morning, lower down at night, you recover when you wake up. This person will eventually, if they continue this pattern, will actually go in the other direction. These will start dropping down. So you have a hyper response here, but eventually it'll be showing up below the curve. This is a really good one to see where some people's statuses are. So looking at some ways to kind of take care of some of these things, of how we can normalize some of the cortisol, is that we can take a look at meditation is one of the things we work at. It improves sleep, alters response to stress, so there's less cortisol. Getting into different states of the brain have worked very, very well. Yoga shown to reduce fast and blood sugar and weight loss. Getting enough sleep. Studies show that even a partial night of bad sleep increases insulin resistance. And we know that if you don't get the proper amount of sleep, inflammation gets increased. What happens is the brain shrinks a little bit, There are some cleaners of the brain that come out that kind of look like window washers, and they'll clean some of the inflammation out as the brain shrinks and goes back to normal. And if you don't get enough sleep, sometimes you never get that chance to get the inflammation off your brain. Now, one of the problems with sugar also, it causes inflammation. And inflammation can also be caused and be accumulative, and it be lifetime factors. Inflammation happens on usually the mucosal barriers, like your digestive barrier. You have a blood-brain barrier. Liver toxicity can be toxified again by too much sugar that's in there. Environmental other influences. Metabolic dysglycemia, that's up and down, not having a very good balance in your sugar handling. Oxidative stress, we talked about some of that in some of the past slides. And then dental infections. And some other environmental factors combined with sugar to create some problems is heavy metal, pesticides, herbicides, phthalates, which are a lot of the plastics that are put in on plastic bottles that are introduced into the environment. On the allopathic side, treatment usually done with medications, and we got various medications, the metformins, glucophages. These are prevents the liver from releasing sugar. One of the problems, usually with metformin, there's a lot of times having some problems with bloating and gas diarrhea. Some people are susceptible to it. You've got these other drugs here that actually produce more insulin. The problem is that we don't want to keep on producing more insulin. You keep on asking the pancreas to push more insulin out, it's going to burn the pancreas out. And then also ones that improve sensitivity that forces more into the cell, which can be some good or bad because there is something called a balance. So that could also cause problems like weight gain, heart failure, and fractures. And these are things based on pretty much not curing the problem. It's just basically for the rest of your life. Here's a study, and you can read through the elements there, but the Mediterranean diet by far and away is for cardiovascular disease, and cardiovascular disease also associated with diabetes is probably one of the best type of diets, especially the oils that are involved, nuts and extra virgin olive oils, good greens. I think a lot of times we think of the Mediterranean, people are eating a lot of pastas and things, but they're eating quite a bit of vegetables, fresh vegetables. They're not contaminated. They grow their farms around the outside of small towns that feed those farms, so everything's grown locally. It doesn't have to travel far. And I want to introduce you to what they call the Psych Principle. And the Psych Principle is kind of like overlaps maybe a little bit of Mediterranean diet, but how to really work on if you really want to try to look at something for weight loss. And something that I put together, probably borrowing from a lot of different sources, but the Psych stands for, S is for sugar substitution. And what you can you find a sugar, if you have a sugar or something you want to substitute, can you substitute for something that has a lower glycemic index? We talked about that before. Something that doesn't jump into the body as fast. Also, can I put more fiber as a substitution? Because fiber has a way of kind of binding up things. We'll talk about that and what I call net carbs in a minute. Maybe some proteins or some fats. What can I do to substitute to get the sugar situation down? Because every time I eat a bit of sugar, every time I have a calorie, I get an insulin response. Intermittent fasting has its grounds in a lot of religions, but also it has some grounds in the current literature, and a lot of people are looking for it to see, like it seems pretty well for weight loss and actually for heart disease and diabetes. We've got to be careful with hypoglycemics, though, because you got to fix your adrenal gland, make sure the adrenal gland is fixed before you do something like this, and try to work with your a good dietitian or a doctor to be able to help you through that. And that seems to work pretty well. And actual recovery and breaking down scar tissue can also be associated with intermittent fasting. Keto diet is a fat-based diet, and what you want to do is try to get away from the sugar pathway to the fat pathway. And with you to the fat pathway, the energy in the fat pathway actually has a tendency to make you have a little bit more energy and also better clarity of mind. And then the last one is exercise, because calories in, calories out. There's some exercises and types of exercises that are very functional. Let's talk net carbs. The net carbs is the total amount of carbs minus total fiber. It is not the total number of sugar, because carbs, so if you take a look, for example, let's say the total carbohydrates is 37 grams, but sugars is 1 gram. You take the total carbs, which are here, and then you subtract the total fiber. That is your net carb. So vegetables are best, especially those that grow above ground. And fiber is especially important to binding up the sugar. So it almost makes sometimes vegetables a kind of like a neutral food. So remember we went back and talked about those things in regards to, food combining, where you don't combine, let's just say, sugar, protein, that was a question, proteins with sugar, but you would want to combine vegetables, goes pretty much with everything. So for example, if you had a steak, you might want to put a vegetable with it. Okay, and that's not a potato because it's high starch. It's a sugar. Or would you do, like, if you had a pasta, would you do red sauce or white sauce? Well, white sauce would have more proteins in it. The red sauce would not. Or you could do spaghetti squash, and that would be a really great substitute. Doesn't matter what you put with it. Now, one of the things on sugar substitutions, you can look at a glycemic index with natural sweeteners. And you get stevia here, a glycemic rate is down low. And also, let's see here, and then yacon syrup, and then xylitol is there. The thing is though, understand that when you do put sweetener on the tongue, sometimes that does cause an insulin release. So we'll sometimes spike some of that because of the sweet taste itself. But it's also, it can limit the calories a little bit more. It can limit how much strength the reaction is into the body. Some additional help with insulin resistance. Master Cleanse is actually one that kind of sets up the body before you do a dietary change. You can take a look online. My version I have is I use a quart of green tea, organic green tea, 3/4 of good mineral water, lemon and lime to taste, and 2 tablespoons of maple syrup grade B. Some people use cayenne pepper. I don't necessarily use that. You don't eat anything else but drink this and sip it through the day. And what you're trying to do is maintain a sugar level that doesn't go too high or too low, but just maintain a sugar level in it. You do that for 2 to 3 days. Don't eat anything else particularly. You have medications, you got to do your medications, but the supplements, you probably want to keep off the supplements at this particular time. And it kind of sets you up for whatever type of food change that you might want to do to kind of control the sugar cravings. Keto diet we'll get into in a minute. Potato starch is interesting because uncooked insoluble starch, it improves insulin stability. Since it's not cooked, it's not going to be absorbed. As a fiber, it becomes like a super fiber. Increases fat burning and optimizes gut flora and prebiotic. But the problem with the downside of it is, if you're feeding bacteria, if your gut is good, then you shouldn't have much problem. But if you have a problem, a gut problem, and your bad bacteria is outnumbering your good, then the bad bacteria will cause methane, and so that you'll have a little more gas in that. So you got to make sure if you're doing that and you're getting that, then you got to be able to take care of this. There's a special bacteria that you got to use that, and some other things you need to do to make that work. Magnesium and potassium, again, are important. I'd rather have potassium in the sense of vegetables, and magnesium too, because again, those are ones that are lowered. And if you have insulin deficiency or resistance, you have a potassium and magnesium deficiency along with that. The certain types of exercises are decent. HIIT is high intensity interval training. It's a resistive training. Light workouts can also do well. HIIT is, you got to make sure you're reasonably healthy if you're going to start doing that. If you have any cardiovascular type of concerns, I do have a little special test to do. But if you have any concerns, you want to make sure you're healthy before you start doing a little bit of high intensity workouts. Intermittent fasting is dietary support. Apple cider vinegar at night, good for high sugars in the morning. So good for, if you have high sugars in the morning, then apple cider at night might be beneficial. If we're talking intermittent fasting, what you want to do is eat an early dinner. Intermittent fasting helps fight obesity and type 2 diabetes, both of which are risk factors for high blood pressure. Body's more sensitive to insulin and leptin after a period of fasting. So that means they're opened up and they work better. Many types of fasting regimes, one of the easiest to comply with is an eating schedule where you can limit your eating to a specific narrow window of each time each day. Recommended you stop eating at least 3 hours and ideally 6 hours prior to bedtime to give your body a significant fasting period. Now, fasting is a natural cleaning process necessary for optimal cellular renewal and function. It also activates stem cells and stimulates mitochondria biosynthesis. The mitochondria is the energy of cells. Most of these rejuvenating and regenerating benefits occur during the refeeding phase, not the starvation phase. Recent highlights the importance of nutritional ketosis when intermittent fasting. While participants lost about 3% of their body weight by eating all their food within 8 consecutive hours each day, by not alternating their dietary choices, if you're eating crap, important disease parameters remained unimproved. So this doesn't mean like, oh, I'll just fast and eat the same crap. That doesn't work. You got to make sure it work, eat the good foods, and add the element of intermittent fasting. There's lots of types of fast, time-restricted feeding. There's a certain time you don't eat beyond or eat before. Intermittent fasting, there's a window of time that's consistently maybe 6 hours where you eat in that particular time frame. Prolonged fasts, water-only fasts combined as they sound, fasting up to 5 days, 10 days, water-based that I have with it. Juice fast is really not a fast because even if you're taking juices in there, you're actually creating some type of calorie. You get a calorie, you're going to have an insulin reaction. It's not actually a fast. Religious fasts, all religions do fasting. Of course, there's eating disorders. If you're somebody who is hypoglycemic, who is bulimic, and have those kind of eating disorders, fasting is not for you because there's nowhere for your body to get anything from. There's no recruitment of fats because you have no fats left. Fast mimicking diet is a packets of things you can buy. They're broths and things like that. Just tries to mimic a fasting element. And so it's just it's kind of like there's one particular company that deals with that. We have circadian rhythms we have to worry about here too. When we're awake, there's certain times that the stomach or the large intestine or the gallbladder or the heart is at its peak, and there's other times where it's weak. And so sometimes, a lot of times they say that it's good to probably eat before 7 o'clock. Reason why that would be good is because it seems like the time for the digestive tract or the pancreas has time to relax and rebuild. And if you're eating at that particular time, it really doesn't have a chance to rebuild. So there is circadian rhythms associated with this. Time-restricted feeding, not what but when. First week going to sleep with hunger pains. Helps to go to sleep earlier so you won't be hungry. Blood sugar changes in less than 2 months. Reversal of fatty livers in months. Sounder sleep. You do a minimum of 12 hours. My Circadian Rhythm app is one to be able to take a look at that. So it's kind of help you how to do that. Decreases hemoglobin A1C and cholesterol problems. Now again, intermittent fasting is not necessarily a diet, it's a pattern of eating. It triggers growth hormones, one out of the 6 fat-burning hormones, and the strongest one. In the presence of insulin, you cannot lose weight. Current trends to have pancreas is pushing out 5 to 7 times more insulin than is needed with the way currently we're eating. Every time you eat, you spike insulin, not just carbs. So it's really basically a pattern of eating in a time where you do not put a calorie in the body. And if you can stimulate growth hormone, which regulates your body composition, body fluids, muscle, bone growth, sugar, and fat metabolism, and possibly heart function, age differences, the younger the body, more production. So it actually makes you feel younger. Gender differences in production. Increases in the sleep, weightlifting, and fasting. This is how you increase it. So better sleep if you do proper weightlifting and then fasting. You increase things when you do the human growth hormone. You also increase neurotransmitters GABA, which is more of a relaxing hormone, neurotransmitter. Affects Parkinson's, Alzheimer's, and motivation and memory. Helps with delta waves for improved sleep. That's that deeper sleep and the restorative sleep. No increase in mortality and higher in cancer with natural approved HGH. 1 day of fasting of HGH goes up from 300% to 2,000%. Fights arteriosclerosis. Muscle mass goes up. responsive to high human growth hormone and ketones. Blood flow increases, blood pressure goes down, cardiac output increases, congested heart failure improves. So again, let's not forget, intermittent fasting seems to help human growth hormone. Now here's a kind of example of kind of like how intermittent fasting works. Typical fashion is we have 5 meals, breakfast, lunch, snack, dinner. Again, every time you eat, you're going to release insulin. Then you go down to 3 meals, or breakfast, lunch, and dinner. And then there's all kinds of differences in between and possibilities. But 3 meals, 16-hour fast, 8 hours foods. So basically, you go from like 6 o'clock in the morning to 6 o'clock or 6 o'clock at night, go through the night, go at 6 o'clock in the morning. You wait to, that's 12 hours. You wait 4 hours before you eat to 10, you between 10 and 6. And you could actually have 3 of these meals. You might have 2 meals. You might subtract 1. And then the advanced one is 2 meals and a 24-hour fast, 4-hour food. So I think the 18-hour probably be the best one. The one I found when I talked to a person by the name of Mark Harris. Mark Harris is a biochemist, a PhD in biochemistry, is an MD and an ND. And his thought process is probably going to be better to have closer to the an 18-hour one where you do that 7 days a week. And then for 2 days out of the month, you have 2 days which are actually on, you do fasting with only just salt, Himalayan sea salt. Some mistakes in intermittent fasting: tired on the diet, using up B vitamins and need for sea salt. Too much fat can affect gallbladder, liver, and pancreas. Pain to the right shoulder, neck, referred area, under the rib cage area. Sorry for the misprint there. Signs of more of the dietary fat, but not the body. Fat needs more time to adjust. The pancreas will help you feel the pancreas will make you feel more bloated or nauseous. Need more lipase, and lipase is a digestive enzyme for fat. And from the pancreas, especially if diabetic. Good reason for counseling with your dietitian. Major hunger with blood sugar problems, dizziness, brain fog, grouchy, craves for sweets. May need another meal to add some electrolytes like bone broth or more fat. Need vegetables and vitamins and minerals. So some tweaking sometimes needs to be done. I forgot I had the slide in here. This is Mark Davis's slide: optimal fasting, fast duration, 6 to 18 hours, 3 to 5 days, 10 to 14 days. So 16 to 18 hours. This is done on a daily basically. Fasting duration 3 to 5 days monthly, and 10 to 14 is 1 to 2 times a year. Only supplement needed is sea salt, a teaspoon a day, divided dosage, 2 liters of water. Can't do until hypoglycemia is controlled. If you have a genetic ACAT or SOD SNP, eating a bad diet must be clean. Check with healthcare with experience. So if you have those kind of problems, you might have a genetic predisposition. It might be hard to go out and do the intermittent fasting. Now, from the Psych Principle, we had sugar substitution, we had intermittent fasting. Here's the keto diet. A ketogenic diet is a dietary approach that focuses on the minimal carbohydrates, moderate amounts of protein, and high healthy fat consumption. The 3 keys to achieving nutritional ketosis: advantage, weight loss, anti-inflammatory, increase in muscle mass, reducing appetite, and lower insulin levels. But some of the major problems here: don't combine sugar with protein, it increases insulin resistance. So we talked about that, the food combining. Use lemon and water for clearing. Use vegetables for vitamins and minerals. Takes time for your body to adapt from dietary fat to body fat to burn. Takes 2 to 6 weeks. Don't forget the signs of overuse. That means if you got some fat going into the right side, it feels like I'm bloated. I feel like I got right shoulder pain. I got pain underneath the ribs. Work with a dietitian on this. Does well with intermittent fasting. Needs a lot of fluids. Sugar-based retained water will drop a lot of water and flush out electrolytes. Need to put back in, so that's why you need the fluids. Don't be constipated before. Have to release toxins. Make sure your bowels are moving well. Some problems with the keto diet: you're eating a lot of bad fats, fried fats, not good fats. You want quality fats. Too much dairy could be in here too. Grass-fed only would be the only way to go with that. Gut health affects the microbiome, so you might have to have some bone broths and things like that. Not enough water. For every gram of carb lost, you lose 4 grams of water. Got to make sure you put it back in. Not combining with intermittent fasting. Intermittent fasting actually helps it more. Eating when not hungry. Too much protein, only 3 to 6 grams per meal. You're only supposed to have only 2 to 3 to 6 grams per meal. Low vegetables, lack of nutrition. You need the vegetables. Too much or not enough fat, ghee, or medium change fatty acids for MCT oil. Too many carbs, try below 30 but not over 50 grams a day. Concern of increased cholesterol. Okay, not measuring food types, 70% fat, 25% protein, 5% carb. My Plate app. Measure ketones, urine acetoacetate, breath acetone, blood test, Keto Mojo. So Keto Mojo is another one you can go to. Is like there's ways to kind of measure my ketones, and there's ketone strips you can do and things of that nature to kind of see if I'm in the proper ketosis. You don't want full-blown ketosis. You want moderate to low ketosis, and that's where your zone is going to be. So sometimes you have to measure that. Now, fasting for ketosis, fasting only. Stem cells stimulate after 48 hours. Neural brain cells, new neural connections can sometimes happen. That's fasting water with just salt. That's why you want to do fasting for a couple days, a month, with the regular intermittent fasting that you were doing. Gut ratios. The gut ratios of the body improve, determines how many calories are absorbed. When fasting, the ratio approaches proper levels. It goes to a reset. Arterial plaques. The body will go after, if it feels it needs to go after, it's go after subpar cells. And some of those are scar tissues, and some of those could be plaques. Even tau proteins in the brain. Scar tissue can reset leaky gut. You get a lot more physical well-being after going up there. Cancer. It's harder to cancer in this kind of environment because, again, sugar feeds the cancer, and you're controlling and keeping the sugars down. Now we have great cards. Eat me anytime. I got leafy greens here. Kale, spinach, romaine lettuces, cruciferous vegetables, broccoli, Brussels sprouts, cabbage, collards, cauliflower. If you need to eat berries or eat fruits, the berries are the best. Blueberries are really good, but and strawberries are to some extent. I will forewarn you. You want to get organic strawberries. The problem is the most heavily pesticide food is strawberries. Good carbs, eat sometimes. Starchy vegetables sometimes. Sweet potatoes are better than potatoes. Some squashes and things of that nature. Sweeter fruits, bananas, pineapple, papaya. Bad carbs, keep away from the grains. Sugary drinks, obviously sugary snacks. There's some supplements that are good. Berberine is shown to be as effective as metformin without the side effects. Alpha-lipoic acid helps prevent nerve damage. Cinnamon, a half a teaspoon daily, shown to drop sugar by 18 to 29%. And here's a great one. Janema rebuilds pancreatic cells, improves insulin sensitivity. It's a tablet form. If you break it down and powder it and put it on your tongue, it's actually a good biofeedback, because what that will do will actually stop the body's ability to taste sweet for 2 hours. And if you crush one pill, the Janema we have, that one pill is probably worth up to about 6 times you can do that. So you can actually last it for a little bit. So if you're not sure about eating something at some place and you want to have some type of biofeedback to keep you from doing it, that's a great way of doing it. Camel's milk increases insulin sensitivity. I got this from a researcher out in California. Basically, he's doing that and using camel's milk in a protein-based form. I think it's from the Sahara group that have that. And it's also very good for autistic children. Chromium picolinate makes the cell 100 times more sensitive to insulin. Magnesium, adequate levels have 71% less risk of diabetes. Vanadium improves insulin sensitivities. And then a lot of these are in combination products. And remember, we spent some time talking about vitamin D. Vitamin D is going to be important too. Again, here's vitamin D again, and it says it's linked to type 2 diabetes. The lack of vitamin D is linked to these. Studies show type 2 diabetes who take 50,000 independent units a week for 8 weeks see an average drop of 7 points in their blood glucose, improves insulin sensitivity, shown to improve insulin secretion as well, bioavailable form needed. You want to see the good range of vitamin D. This is one of the things you should do in your blood work is looking at vitamin D. And if I didn't mention that before, it's good to see those levels. But you want to see it between 60 and 80. The medical model is between 30 and 100, and I think 30 is too low, especially in the land of COVID. If you have pre-diabetes or type 2, you need to keep your eye on your sugar levels, prevents uncontrolled problems and awareness, helps analyze what helps and hurts your sugar level. Always take at the same time, morning fasting and evening post-meal. Both are actually pretty good for doing that. Why exercise is so important, using muscle burns through the stored sugar. Muscles pull sugar from the bloodstream. More muscle mass you have, the more sugar you can use even at rest. Improves insulin sensitivity and keeps your blood sugar low. Again, dietary choices. If you don't do the other type of things that we talked about, you can still try to look at lower index foods, protein and good fat, and high fiber to stabilize sugar. Avoid sugary drinks. Whole unprocessed foods balance your blood sugar, reduce inflammation, improve your liver detoxification, which is good. Again, the liver also stores sugar, so it takes a little load off. Omega-3 fats, colorful vegetables, nuts and seeds, etc. They can alter genetic expression, improve insulin resistance. And again, we don't get enough fish and fish oils in our bodies too. This is a great anti-inflammatory piece. Now, one of the things you talk about is the dietary aspect. Well, what can you do for the mind? Again, Tai Chi is a very good thing. It's and all yoga would be the same type of thing. You have focus, breathing, and movement. Transcendental meditation to calm the body down. Heart math is a biofeedback piece that works pretty well. And the heart math is basically it measures your heart rate and sees if you're in a panic zone and tells you to go and take a couple of breathings. So breathing techniques also should be another part of this type thing. It gives you an idea about what heart math does. Heart math sends signals to the brain that can influence perception and emotional experience and higher mental processes. This is frustration and the body's erratic, and you can see coherent heart rhythms when the body has joy, whatever, and it's relaxed. More of an even flow. It's not helter-skelter. It's not chaotic. It's well controlled. And again, more things on exercise. It's shown to have a strong blood sugar balancing effect, loss of visceral effect, increased parasympathetic activity. Again, calms the brain down, improve insulin sensitivity, helps relieve stress and improve sleep, detoxify and anti-inflammatory, and increase muscle mass, as we talked about that before. But by all means, exercise smart. Must be cautious if you have high blood pressure. Insulin causes blood pressure to rise. Start gradual if you're diagnosed with hypertension, especially if you're above 160 over 100. Talk to your doctor. Start with daily walking and progress as directed. Choose an exercise you can enjoy consistently, more important than intensity. 200,000 calories a week. 2,000 calories a week. So if you're checking to see how the heart is doing, you do a 1-minute heart rate recovery rate check. You check a resting heart rate at your radial pulse or carotid pulse. And you do 70% of peak workout, jumping jacks, squats, stairs. Measure pulse for 1 minute. After 1 minute, this is your peak pulse. Wait 1 minute, then record the pulse again, and record the pulse. The measurement is the difference between the peak pulse minus the recovery pulse. If it's less than 12 beats, increased risk for a heart attack. That would be something, if you're in there less than 12, if you're doing it at 70% for a minute and you can only come down less than 12 beats, then you would do maybe a stress test or talk to a cardiologist of some sort. 13 to 20 is a moderate risk, and 21 to 40 is very good. Check with your PCP, your primary care physician, for a cardio workout if high risk, and consider short workouts with long rest recovery times until you can build your body up. Now, here is a carotid pulse. You can take that, just slide that back halfway middle part of the neck area, feel for the pulse, and check your pulse rate that way. So exercise goals are working it slowly, and it depends on your condition, physically sound, full cardio exam with stress test, aerobic and anaerobic, cross-training, changing up muscle groups, proper warm-ups and cool-downs. Now, one of the things that we do in our office is chiropractic care, and you want to think about how does this help with the sugar handling type thing. Realigning the joints, especially under the special of the spine, T5 to T7, definitely strong nerve response to sugar handling. Joint stress equals also cortisol. So the cortisol gets inflamed with joint stress. But also T5, T7, big things with like how the pancreas does. CMT, which is adjusting, shown to decrease cortisol and influence brain activity, and it has an effect on parasympathetics. Cranial bone adjusting, jaw muscle therapy, 56% of neural input to the brain comes from the trigeminal nerve, lowering this down and lowering the pressures of the stress mechanism involved. Additionally, on spinal issues, every joint talks to the brain continuously. Irritation of joints causes stress hormone productions. Increased pain, increased cortisol. Increased cortisol, increased sugar. Nerve flow to the organ associated with sugar metabolism. Liver is T7, pancreas is T5. Mid-back pain. Should also add the adrenals run about T9. And then also sugar equals inflammation, increased joint breakdown equals pain. Here's how we can help you. You take a good history. When did things start? When did things change? A lot of things like, for example, even with thyroid conditions, because sometimes they can be worsened by sugar, or event change in life. Did it happen around puberty, hormonal changes? Did it happen around the death of a loved one? Is there a time when something changed and the body got overwhelmed? So history is very important, especially dietary aspects. What are you eating? How much carbs are you having? Are you doing food combining? Are you eating the right type of diet for yourself? There's a lot of filters to put in food. Allergies and sensitivities can play a part in this. That can cause an inflammatory reaction. It can also cause a sugar imbalance in relationship to that. So again, looking at the stresses, what's your medical history? What do you have? Blood labs are extremely important. We went over those, cardiovascular points and the lipid values. We looked at the sugar values and the inflammatory values. It's very, very important to have those. Adrenal spin index, we covered that also. How you could see your circadian rhythms. How does the body handle sugar? Is it handling it well, or is it starting to break down? Neurological exam, we saw that also that basically a stressed out system, especially a diabetic system, can affect the neurology, especially at the distal parts of the body, on your toes and your fingers and things of that nature. So these neuropathies are associated with these kind of problems. So do a neuro exam. Orthopedic, we just talked about the joints. Are the joints working the way they're supposed to? Applied kinesiology, which is a great way to test the body a little deeper. You can use acupuncture points. You can use muscles that tell in relationship to organ systems. You can find out muscles going weak related to it. So every muscle has an organ relationship. Every organ relationship has a spinal relationship. So it's interesting to see that where is the stress mechanism of the body and to restore those. Acupuncture itself is very, very good. And so again, acupuncture, also one of the key things I find with it is actually moving energy, moving blood flow into its proper direction. And so sometimes blood flow is stagnant in one place and doesn't feed another one, can cause a problem or distress to the system. In conclusion, and I always seem to run into this every time I do a talk or anything that has to do with maybe visceral or cardiac or cancer or sugar handling type problems. And who are the healthiest people in the world? And, Okinawa, Japan, and then he's got people in Greece and Sardinia, Italy, and Costa Rica, and the Seventh Adventists out of California. And they all have a lot of things in common. And they have a very similar, like Mediterranean type diet. They have a lot of fish, so that basically has a lot of omega-3s inside their cells. We do have something called brain span, which is actually another thing that could be listed in the blood work, depending on cognitive ability, that they seem to have a higher level than anybody else. They seem to have more 100-year-olds in ratio than anywhere else in the world. They also don't take the life seriously, so they have a little bit of control of cortisol type elements. And they're always either doing farming or they're doing some type of natural, like walking gardening, those kind of things. They're always active and movement, Tai Chi, yoga, stretching. They're always doing things that are good. And those are the overlaps that make things right. The vegetable-based diet. That's where we need to be. And a lot of things I'm talking about, they're doing. So I hope in this offer this evening I gave you some information that you can possibly use. Some of these things you probably need some assistance with, and you can take advantage of an offer that we have. We have a free chiropractic evaluation and consultation, which covers all those things we talked about. If we need to do certain tests, we can do those. History, neurological exam, applied kinesiology exam, and consult, all those things. There is a test to show your acupuncture meridians and how strong or weak they are. We do sitting, standing, and laying down blood tests. We do a zinc test. Zinc is very, very important for sugar itself. And so those are things that are done instead of a $225 value. We're going to do it as a donation to a charity called Caring for Others. Now, Caring for Others, they do for help for local medical work for people who can't afford it. Also give them grants for studies and things of that nature, scholarships for that. Helping the local food bank, so that $99, I don't get any of it. It actually goes to the Caring for Others, the 501c. So it's a nonprofit and it's a tax write-off for you. If it's something that you can't use for yourself, but it's something else you can help somebody, then you can ready to take the next step and you want to offer this to a friend, you can do that. Have it for a loved one that needs some help with something like that and has a different idea how to do that and needs some guidance. This is the way to go. So thank you for taking your time, and much appreciate it. And God bless, and have a better day tomorrow.